So this mouse that I made, the first one, we called her Hope because I was having trouble getting my grant funded, and I hoped that after I had the mouse, I would get my grant, so we called her Hope. Mm-hmm. So she had, we have 2 copies of every gene that we have on 2 pieces of DNA. Hope had only the alteration on 1 copy of her DNA. So we had to use her as a way to get a mouse that had the alteration on both copies. So we bred Hope to a normal mouse. Half of the offspring had the same genetic alteration. And then we took those offspring and bred them back to Hope, so that we were breeding 2 mice together that had 1 alteration. And then 1/4 of them would have both copies altered. Well, I made Hope because I was interested in the function of a gene called CD73. And I was suspicious that this gene was important for the development of the immune system, because patients with certain immune deficiency diseases didn't have very much of the gene. And we also found that its expression increased as lymphocytes matured. So we hoped that these mice would have a problem with lymphocyte development, but in fact they do not, which is often the way when you spend a lot of time and effort making a genetically engineered mouse. They often don't have the phenotype you expect. But we also anticipated that mice that didn't have CD73 would have more severe inflammatory disease, and that has turned out to be the case. So there are several experimental models of inflammatory disease where these mice have a more severe reaction. So that allows us to understand how CD73 normally controls inflammation. So the mice have been used in studies of hypoxia and multiple sclerosis, and in various sepsis models, and also models of ischemic heart disease. CD73 actually helps protect your heart when it has brief periods of ischemia. And they also have been used in models of inflammatory bowel disease. So they have a lot of, in the mice they also have osteoporosis. So they have a lot of different phenotypes that allow you to understand kind of how various human diseases develop. Normally when you try to make these genetically engineered mice, you hope to have many copies of, I had only 1. So I thought, oh my God, what if she's not a good mother? You tend to get bigger litters with hybrids. So she had 2 of 16. She had 16 pup litters, and they all lived. And she only has 8 feeding stations. She was fabulous.